What is age-related hearing loss or presbycusis? Have you ever noticed that conversations seem harder to follow as you age? This could be due to age-related hearing loss, also known as presbycusis. This condition is a gradual and permanent decline in hearing ability that typically occurs as people grow older. It affects both ears and primarily impacts the ability to hear higher frequency sounds, like speech. This makes understanding conversations, especially in noisy places, quite challenging. Presbycusis arises from natural age-related changes in the inner ear structures. The cochlea, a key part of the inner ear, along with the auditory nerves that send sound signals to the brain, undergo degeneration. The tiny hair cells in the inner ear, which are responsible for converting sound waves into nerve signals, become damaged or die over time. And like some animals, humans cannot regenerate these cells, leading to sensory neural hearing loss. This type of hearing loss indicates that the issue lies within the sensory or nerve pathways, rather than in the outer or middle ear. Several factors contribute to presbycusis. These include genetic predisposition, long-term exposure to environmental noise, and certain medical conditions like diabetes. Lifestyle choices, such as smoking, can also play a role. The aging process itself is a significant factor. Presbycusis often runs in families and can begin as early as a person's 30s or 40s, gradually worsening with age. By the time individuals reach 65, about 1 in 3 adults experience some degree of hearing loss. This number increases to nearly half of adults by the age of 75. Common symptoms of presbycusis include difficulty hearing conversations, especially when there is background noise. People may find themselves raising the volume on televisions or radios, frequently asking others to repeat themselves, and sometimes experiencing tinnitus, which is a ringing in the ears. Balance problems can also occur. Because this hearing loss develops slowly, many individuals may not recognize it at first. The impact of presbycusis on quality of life can be significant. It can hinder communication, leading to feelings of social isolation, frustration, and even depression. Additionally, it can pose safety risks if individuals cannot hear important sounds, such as alarms or approaching vehicles. Currently, there is no cure or way to prevent presbycusis. However, it can be managed effectively through the use of hearing aids or surgical implants that amplify sound. While these treatments can improve hearing ability, they do not restore lost hearing. Early diagnosis and intervention by hearing health professionals are crucial for maintaining communication and enhancing quality of life. In essence, presbycusis is a natural part of aging that results from changes in the inner ear and auditory nerves. It affects many older adults and requires management to support hearing and communication. If you suspect you or a loved one may be experiencing hearing loss, consulting a healthcare professional is essential for proper evaluation and support.